Coronary calcium score. Somebody asked me a question about that and asked, well, should they get that done? Is it covered by insurance? Somebody told them they had to pay out of pocket. I'm Dr. Monica Agarwal. I'm a preventive cardiologist who focuses on nutrition and lifestyle to heal the body. So a coronary calcium score is a great test, I think I've mentioned before, where you get kind of an x-ray of your heart. It tells you if you have calcium in your heart, which is older plaque. So it doesn't tell you if you have any soft or new plaque, but it does tell you if you have older plaque. So it's a really good way to risk stratify, to tell us how aggressively we need to manage somebody. Does the statin, despite your age, so should we put you on a statin despite your age being lower or higher, and sort of if your family history is high or low, it helps us decide whether you should be on medications. Is it covered by insurance? No. It's hard to get it covered by insurance. You're usually going to pay out of pocket somewhere between $80 to $110, but it's worth it. If your doctor recommends it, think about getting it done.